Mr. Brady, now I yield myself as much time I may consume. Today, the Oversight Subcommittee will examine the effects of gun violence on communities across our country. We are in a crisis, an American crisis that threatens the heart and soul of our nation. We must help our friends, families, and neighbors who hope, pray, and beg for leadership. We need leadership, now more than ever before. Every year, thousands of people die from gun violence. Parents and children, sisters, brothers, friends, and neighbors. No one, but no one is safe. You can be at home, at school, at work, or the grocery store, or at a festival, or worship. No place feels safe. Too many are hurting, too many are mourning, too many are suffering. Yesterday, people came from all across the country to demand action to stem gun violence. You heard their story and felt their pain. Your heart would break. Gun violence does not care what color your skin is, how old you are, where you live, or where you worship. It scars our communities and tears at the fiber of our nation. Those who experience gun violence know, as I do, that we are facing a public health crisis in this country. And we must act, we must do something. These are the reasons that I would like to thank our colleagues and all the witnesses for sharing their personal stories. I know sometimes it is hard, it is difficult. Sharing your knowledge with us today. Your courage and passion are an inspiration to us all. Today we will hear from survivors, loved ones, and experts about the forgotten reality of gun violence. For those who survive, the path toward recovery is difficult. For those who lost their loved ones, the cost can never be measured. Unfortunately, the cost of gun violence goes beyond the pain felt by victims, families, and friends. We cannot begin to measure the emotional or economic cost of this unbelievable trauma. Since 1996, a lack of research funding prevented the Center for Disease Control, located in my congressional district, from studying gun violence. This policy keeps the public from learning more about the total cost of gun violence. We need more research so that we can save more lives, but we can begin our work by studying the effect of gun violence on doctors, health systems, and healthcare providers. We know that it costs hundreds of millions of dollars to care for survivors in hospital and emergency room, and billions in other health costs and lost wages. In the face of this grave reality, Congress has a moral obligation to act. Each of us must do our part. Every second, every minute, every hour delay is a matter of life and death, a matter of healthy living or unimaginable suffering. As we conduct this work, we must be thoughtful, we must be mindful, and compassion should be our guide. I thank all of the witnesses, thank each and every one of you for being here. I want to thank our colleagues for being here and willing to testify. Now it is my honor and pleasure to recognize the ranking member of the subcommittee, my good friend and brother, Mr. Kelly.
Thank you, Chairman Lewis.